welcome to the AgeUK London Spring Booster event, which is one of a series of events we've been running right through last winter and autumn and winter and now into spring around the need for vaccines for COVID and for flu. This time it's just about the COVID spring booster. The NHS England has announced that they've done half of the people already. And I want to introduce you to Sharon, who's hosting the meeting, and Kathleen, who are both the campaigns staff at AgeUK London. I am a trustee of AgeUK London, and I was a GP for over 25 years in the London Borough of Brent. And Dr. Ilozue is a GP currently in the London Borough of Barnet, and she will introduce her formal title she's one of the vaccine leads for NHS England. And I'm sorry, I didn't quite get your title correct before I joined the meeting, Dr. Ilozue. But Dr. Ilozue will be speaking and helping to answer questions. And AgeUK Dutta is the chair of the Greater London Forum for Older People, and he will be giving us an introduction shortly. Before we do that, you've all been sent an equalities monitoring form. Please, after the meeting, will you fill it out and return it? It's really helpful for us so we know who's attended, who we need to perhaps target our publicity to in the future to make sure we've got a broad mix of people who come to our meetings, and it also helps us to monitor the quality of what we do. So it's something to help us to learn. We have received a number of questions already from you. Thank you. About 50 of you have sent in, or we've had 50 questions in from you already. What we've done is we've collated them into broad categories, and we will be reading out some of those questions and asking our speakers to answer them as we go through. But you will also have an opportunity to follow up with your own questions later on in the meeting. So there'll be plenty of opportunity for interaction as we go through the meeting. And if you've got any further questions, the best thing to do is, because we're quite a large meeting, is to post them in the chat. Can you just make sure you post it to everyone, and then everyone can see your question, and we can get a bit of a discussion going, hopefully, between the chat and the speakers answering your questions and discussing the issues. Okay, I'm now going to hand over to AgeUK Dutta, the chair of the Greater London Forum for Older People, to add his welcome to our meeting. AgeUK.
Thank you, Tony. As you mentioned, I'm a chair of the Greater London Forum for Older People. I also chair the subgroup of the BAME subgroup of the Greater London Forum, where we are working with the BAME communities, the older people in the BAME communities throughout London. And one of the issues that we have seen is the number of deaths from the older people from the BAME communities is far higher than proportionately far higher than it should be. And there are a variety of reasons for that. And some of the reasons are because of the poverty, because of the housing conditions, because of the knowledge and not being able to access the GP services when they needed it. What we have been doing is to encourage that they should get vaccinated and ask the GP, or if they are not registered the GP, to consult with the local NHS patient number there to get the vaccination. So far it has increased, but it's not sufficient. And I think what we would like to do is to encourage, like I got my call from my local GP and they suggested which surgery I should go for my vaccine, the booster vaccine, the spring booster. There are the number of pharmacies, they're doing the booster also, but they are not always in the same category of the vaccination that we had before. For example, I had Pfizer and I wanted to get the booster from the Pfizer. And it's only my GP knew about it, and therefore she directed me to the surgery where they can giving Pfizer vaccination. So this is what we will be doing also. And I hope that we have got a large number of questions, as Tony mentioned. So some of the questions, if we can, we'll answer them. And I'm sure Dr. Ilozue would be able to mention quite a lot of them. So I hand over to Tony. Thanks very much.
Thank you so much, Ashok. When you were speaking just now, I might cast my mind back to 2 years ago in the early weeks of the pandemic and the first lockdown. And I read with some horror that one of the electoral wards very near where I live had the highest death rate in the country right at the start. That was in Brent in Church End. And it was just the ward the other side of the park where I used to exercise every day. And it really brought it home to me just how awful this pandemic was. And as you said, there's a very high level of Black and minority ethnic people who still do live in that ward. And a lot of them were still having to mix with the public. They couldn't sit in their home offices on Zoom as many of us could. And it really brought it home to me. And I've subsequently, of course, learned a lot more, not only about the pandemic, but about people's response to it and to the vaccination program. So thank you for highlighting that. Very, very humbling. I'm now going to turn straight to Dr. Ilozue. And I'm sorry, Dr. Ilozue, could you please spell out your official title? I know that you're a GP, but I didn't look up your official vaccine lead title. And I also want to welcome Stephanie from NHS England, who is somewhere in this meeting. So Dr. Ilozue.
Hello, thank you so much for having me this afternoon. So I'm Ilozue. I'm a GP based in North London, Barnet, and I've also been working as a senior clinical advisor to the COVID vaccination program, and that's London region. So it is part of NHS England, but specifically the London region. And I've been taking part in webinars like this over the last year. The main aim is to disseminate information as clearly as possible. And I was also part of my local vaccine hub in my area. We had a group of GP practices, over 20 practices joined together to provide vaccine services for our community, our care homes, our patients. So I was there vaccinating. And yeah, no, really pleased to be here and looking forward to engaging with you all and answering as many of your questions. Thank you for sending them in.
Do you want to say any more at this stage, or do you want to go straight into the questions?
I could do. So generally speaking, in terms of it, this is a spring booster event. And I'm sure a lot of you know, and hopefully a lot of you who are eligible have been offered this, but you'll be offered a spring booster if you're over 75 years old. If you live in a care home for older people, that sounds a bit ambiguous, but what we've been told is over 65-year-olds broadly speaking. And also if you're age 12 and over and have a weakened immune system. So there was some confusion over that, but generally it's a narrow group of people that were eligible for this spring booster campaign, which we've been busy doing over the last month or so. So that's the basis of it, and open to answer the questions that have been submitted about it.
Okay, thank you very much. I see that somebody's already started posting a question in the chat. Thank you very much. And I've got quite a lot of questions that I've got up here in front of me on my screen. And what I think I want to do is to go through the categories so we cover all the areas. But please do, if you've got supplementary questions, please put them in the chat and we'll cover those later. And hopefully we'll get you as individuals, when you ask a question, to ask your question to the whole meeting, so we don't end up doing all the talking. I'm just going to plow through this, and if between us speakers we can contribute to the questions, but Dr. Ilozue, I think it's going to be mainly you.
That's right.
Okay, eligibility is the first criteria. There's a lot of questions, and some of them quite complex, about eligibility for the spring booster. So
Did
here
Sharon want to say something? Sorry.
Oh, Sharon,
I'm just thinking, do you want me to put up the questions that were submitted in categories? Might that help on the chat? Or do you want to just go through them as you have the list?
Why don't we just go through them?
I believe that Stephanie sent them over to you also, Dr. Ilozue.
Yes.
Right, eligibility. I'm 76 years old and had 2 vaccines and a booster. Do I really need to take the spring booster as well? I'll give you 3 or 4. On the other hand, I'm 72. If and when will I qualify for the spring booster? I'm age 73 and was classed clinically vulnerable throughout lockdowns, yet it seems I'm not now eligible for the spring booster. Why? Could we start with those 3? So there's a 76-year-old, do I need the booster? A 72-year-old, when will I qualify? And I was clinically vulnerable, but I don't seem to be eligible now. What gives?
Really great question. So the 76-year-old who has had 2 vaccines and a booster, probably the booster was given around September, October 2021 last year. So we go by recommendations of our Joint Committee for Vaccinations and Immunizations, the JVCI. These are the experts that analyzed all the data and came up with the advice and the recommendation for the spring booster campaign, which the government agreed to and we started doing. So they gave a much narrower group of patients we should target for this spring booster. So everyone over 75-year-olds, because we know age is one of the biggest risk factors in the risk of complications from COVID-19 infection and also the risk of hospitalization. So those are the priorities, to reduce mortality as well as hospitalization and severe illness. So that's why it was recommended everyone over the age 75 should have the booster campaign. We also know our care home residents were also severely affected. My local care home had several deaths right at the beginning. We managed to go in and vaccinate early in 2021, and there were no deaths last year from COVID. So they made a massive difference, the vaccine, hence why they're also included in the spring booster for that extra layer of protection. Now, the third group are those who are severely immunocompromised. So this is the group that causes a little bit of confusion. So anyone over 12 who is classified as severely immunocompromised. So that includes things like blood cancers, leukemia or lymphoma diagnosis, people who have a weakened immune system due to treatments, medication they're on, steroids, biological medications, chemotherapy or radiotherapy, and currently going through that or taking that medication. Anyone who's had a transplant, so are on very powerful immunosuppressant medication. Any condition that means you have a very high risk of getting an infection. And usually you would be advised by your specialist team that you're eligible for this spring booster. And in many cases, this will be a 5th dose of the vaccine, because you would have had your 1st, your 2nd, a booster, a 4th dose. So this will be the 5th dose. So the person that asked the question that's over 76, you're eligible, you should have been invited. And the recommendation is that you should take the spring booster to offer maximum protection. The 72-year-old is not eligible for the spring booster. And the 73-year-old that was classed as clinically vulnerable, the clinically vulnerable group, those who are shielding, was a much wider range than those who are in this severely immunocompromised group. So just because you were in the clinically vulnerable group before and may have been shielding at the earlier stages of the pandemic, it doesn't mean that you're eligible for the spring booster. It is a narrower group. So But I would say have the one-to-one discussion with your GP, or if you're under specialist treatment, have that discussion with your specialist.
That's important. There are always going to be the questions and the sort of slightly grey areas, aren't there? Yes. So someone's here said, I've had 4 vaccinations. Do I need a 5th? That was presumably someone who was in that category of severe immunocompromised.
Yeah, the JVCI again looked at the research, and if you're severely immunocompromised, you're not mounting as good an antibody response as the rest of us who are not in that category. Hence the advice to give that extra layer of protection with the further 4th or 5th dose.
Right. Now, here's somebody, this is an interesting question. I'm a healthy 71-year-old with minor disabling conditions. I look after my 3 young grandchildren and do school runs too. When will I be eligible for my 4th booster? And my guess is that the questioner thinks that because of doing the grandchildren, they might be more at risk of catching the virus.
I mean, first of all, how wonderful. My mother's been involved in grandkids care too. And it's just the most amazing having that multi-generational input into our kids' lives. So at the moment, being 71, you're not eligible for the spring booster, but we're waiting to hear further advice about what's going to happen come autumn. Because of course, we know we have our seasonal flu campaign that starts up every September, October. We assume at the moment that a COVID booster will be offered to people again in a similar vein to the flu vaccine, but we don't know the details yet. So being 71, you're not currently eligible for the spring booster, but watch this space about what information we're going to hear come autumn.
Okay, and here's another little conundrum for you. When will over 70s get their 4th jab? And are we safe without a jab since having the 3rd jab in October, especially if we want to go abroad? So aspiring travelers.
Yeah, no, really good question. So in terms of the requirements to go abroad, every country will have its own specific requirements and things that you'll need to do before you go, when you get there, documentation you need to take. So you need to look that up. Again, being under 75, and if you're not in the immunosuppressed category and you don't live in a care home, you aren't eligible for the spring booster, but whether the 4th jab or whether it'll be the annual, because we don't count the number of flu jabs we've all had, we just get it every year. So we'll wait to hear when and who will be eligible for we assume will be an autumn campaign for a coronavirus booster, but are we going to call it the booster anymore? Will we move our language to say it's a seasonal vaccination like flu? We await. We are still in a pandemic though. So that's one of the reasons why the language and the work around the coronavirus vaccine has been slightly different, but we do need to look at all vaccination against infectious diseases in the same vein, especially as we hopefully see the end of the pandemic soon in terms of numbers of cases and prevalence of infection.
But of course, as you suggest, we don't really know what's going to happen come the winter.
Yeah, we don't.
Because winter time is virus time, whether we like it or not.
Exactly.
Right. Thank you for all those people who've been putting questions in chat. I'm trying to keep it to the eligibility category still. But so how long after the 3rd vaccine? Oh, Katie, would you like to ask your question? Is Katie there?
Yeah. Well, I'm visiting a friend. She's 82 and she says she hasn't had a letter. So I was just wondering how many months after the 3rd one is she supposed to have the 4th one, because she's locked in, she won't go out unless I take her.
Really good question. So the initial recommendation said 6 months after the 3rd vaccine, but then that's been relaxed somewhat to say anytime from 3 months onwards, you can get the vaccine. So instead of waiting for a letter, maybe yourself or your friend can contact their local service, or there is a national book your coronavirus vaccine. And if you put your information into that, it will tell you whether or not you're eligible to book that from now. So that's another tool that could be utilized to see if someone is able to have their vaccine now.
So I should just put in her details first and see, because she's not computer literate now. So
yeah, if it's been 3 months and more after her booster dose, then she can get her vaccine now.
All right, thank you.
Thank you very much, Katie. Is Nira here? to ask your question about not being called yet? If not, I'll read it out.
Yeah, Nira is here.
Yes, I am here. Slightly different question from that one. I'm a healthy, active 71-year-old. I get invited to have the flu vaccine annually, but so far I've not taken it because I hardly get colds or coughs, let alone flu. But obviously with the COVID vaccinations, I did take all three, the first two and the booster. After the second one and before the booster, I did get COVID, but I had very mild symptoms. I would describe it as having a flu, like flu symptoms. And the symptoms were only worst the first 2 to 3 nights. When I say that, what I mean is during the night, I know I felt hot and I was feverish a couple of nights. But as soon as I woke up in the morning, I was fine. And I'm the Nira who looks after her 3 grandchildren. So I was still doing the school runs, still looking after them after school, feeding them, playing with them, all that. So it was quite kind of puzzling to have been tested positive and not had severe side effects from the COVID. I had my booster in November. Obviously, I had to delay it because I had COVID. So NHS advised me to wait 28 days before I have the booster. So I had my booster in November. I suppose my question is, I am keen to have the spring booster if and when they give it to me. But does my status, the flu vaccine status, remain the same? Because like I said, I hardly get even colds and coughs. Obviously, in future, if things change, I will take the offer of the flu vaccine. But I have a good immunity. I have a very good diet. I'm not overweight or anything. I'm very active physically and mentally. I want to ask what your view is on what I've said, how I've described myself and my lifestyle.
Thank you very much. Really helpful to hear directly from you. So being 71 years, I think you said, you're not eligible for the current spring booster. We wait to hear more information about the autumn campaign and what that will look like. Every year, all over 65-year-olds are offered the flu vaccine. We've been doing that for many, many years, so that won't change. Come September, you'll be offered the flu vaccine like previous years. We're just waiting to hear whether the COVID vaccine will be offered alongside, as it happened last year, with the booster doses that we started about September time, I believe it was last year. So brilliant that you keep yourself so fit and healthy, but really good to hear that you still proceeded and had your first, your second and your third dose, because we know that vaccination is the most important protection. We have a big toolkit of things to protect us against COVID vaccine infection during this pandemic. So that included the hand washing, hand sanitizing, face masks, social distancing, the lockdowns to a certain extent as well. But now we're kind of going into life after and emerging. And as we all know, all restrictions have been lifted. The vaccination is our most powerful tool to prevent severe infection. So as you say, people may develop COVID after being vaccinated, but largely it's a much milder infection than if they haven't been vaccinated. So people admitted into hospital and ITU by far were mostly unvaccinated individuals of all age groups compared to those who are vaccinated. So really important to stress how safe and efficacious, how good this vaccine has been at protecting us from severe disease. So brilliant that you've had your first, your second, you then got COVID, and then the recommendation is you wait 28 days after an active infection, even if you don't feel unwell, before getting a vaccine if you're eligible for that. So at the moment, you're not eligible for this spring booster campaign, but watch this space about what happens come autumn.
Oh, thank you for that. I will say one thing. I was disappointed when I found out that I was positive, because I wasn't going anywhere except to school and back.
Yeah.
And I always I still wear the face mask,
Sure.
even though, you know, we are outdoors when collecting the kids. The reason is because they're all 3 different age children, and they have staggered start and finishing times. And I'm hanging around in the playground for almost 45 minutes. So, and some people, some parents are still kind of standing quite close, or, you know, coming quite close towards me. So I still wear the face covering. But yes, I was a bit disappointed. But had I not done the PCR test, I wouldn't have known it was COVID. It was just like a mild flu, which I thought was about time I had it and I got immune to it. So, yeah.
And that's what we're hoping. We're hoping that COVID becomes a disease that doesn't cause the problems we've seen. I mean, we had that, you know, the information about all the deaths it caused early on, all the severe complications it can cause. So what we're hoping with the protection of vaccination, exposure of our immune systems to infection, that the disease doesn't become the problem it is. It is a milder infection, even if you catch it. And people shouldn't get disappointed if they test positive for COVID after vaccination. I know people felt the vaccine may protect them fully from infection. We have to remember we're still in a pandemic. The case numbers are really, really high. And especially if you're exposed to kids, we call them the super infectors, you know, children. They are going to, so that's why it's so important to get vaccinated to protect ourselves. And by default, we do protect those around us, but that doesn't mean that the risk of infection is zero. The risk of severe infection is massively reduced, and hospitalization as well. And that's been the real benefit of the vaccinations.
Sure. Thank you very much, Doctor.
Thank you so much, Nira. We've just got to move on now. Ira has asked, are all over 70s who've had their 3rd booster safe until the autumn, when I presume we will be offered the 4th booster then? And I think the answer to that is yes.
Yeah, the JVCI looked at the data really carefully and made their recommendations based on what the evidence was showing. Obviously, I'd still recommend taking precautions, especially in crowded spaces. And yeah, just being generally keeping yourself as well as possible, because there are other ways to keep healthy, be active, as if that's possible for you. So generally speaking, we have to go by that national guidance, and that is based on really good evidence.
Okay, Ira, I hope that's okay that I read your question out. If you want to come back, will you post something back in the chat again? I'm just aware we've got to keep moving. Now, this is Jeffrey. Jeffrey, would you like to ask your question? This is an important one. Thanks, Ira. Jeffrey, are you there?
I think so.
Yeah. I am indeed. I was muted for a while. Yes, my question is how can I discover whether I'm entitled to a 4th treatment if I am, because I have to have somebody visit me at home. I'm hemiplegic. I can't leave the house, so it really becomes a matter. I think the last time I had a vaccination, it was from the district nurses.
Yeah.
And I presume GPs did my first ones, but the top up, I think, was by the district nurses, and presumably they are dealing with it generally, are they?
So yeah, no, really important question. So you are eligible for the spring booster, being over 75. It is really important because the housebounds should be visited at home to get their vaccine in the way that you had your previous doses. Sometimes the coding and GP practices aren't always up to date. You know, the searches don't always identify everyone. So I will be calling your GP practice to make sure that you are on the list, because just to be completely transparent, the workforce, there has been a workforce issue in terms of district or community nurses or practices being able to get round to all the housebounds. So they should be making their way round, but really important you contact your local GP practice to make sure you are on that list and someone will get to you, but you should expect to get your vaccine at home.
So I contact the GPs, not the district nurses.
Yes, I would say that, because every area, and it changes. So for instance, in my area, the community teams helped with the housebound. They were struggling to get round, so we jumped in and helped out with some of the backlog. This time round, the community team said they didn't have capacity, so we had to organize ourselves to do our own housebounds. So it will flux and change depending on the situation, and every area is different. And if it's not your own GP practice, your GP practice may be working with hubs in a locality. So my GP practice network worked together with another network to provide the vaccines locally. So, but your GP should be identifying lists of housebounds or extra vulnerable to submit to those teams. So it is the first, that's what I would recommend, to make sure you're on that housebound list.
Okay, we wouldn't wait for a call.
I would make sure you're on the list, especially that we're now coming to middle of May and the campaign's been going on for about 4-6 weeks now. So just make sure that you are on a list and that people are making their way around the housebounds in your area.
You're clearly eligible, and I think you must be proactive and call them and saying, where's my booster, please?
It will be done. It will be done.
Super. Thank you very much.
Thank you.
Thank you, Frank, from AgeUK Wandsworth. I may come back to you later. And also, Faye, we're going to come on to side effects a little bit later on. So if you don't mind, I'm going to skip over your question right now. And we're also going to come on to this, whether we have the same vaccine or not. And sorry, I hadn't seen this one. And we'll come back to you, Faye, as well. Now, I think what we can do now is move on to the next category, which is safety and efficacy. And I've got a number of fairly similar questions. So I'm going to group them together. And I can always repeat them if I've asked you too many at once. How long should one wait for a second booster, a spring booster, and how safe is it? How much does the spring booster increase one's immunity? Can or should you have the same booster if you previously had a Pfizer vaccine? And there are a number of questions about, can you have the same, should you have the same vaccine as you had before, or is it all okay to have a different one? So perhaps you can address that. And how effective is the second booster against the Omicron variant? You're okay with all of those?
Yeah, no, good questions. So the first one, how long should one wait for a second booster and how safe it is? So the vaccines have all been found to be really safe. And especially now that we've vaccinated, you know, millions and millions of people, they are very safe. There are some side effects and we would be amiss to not mention it. But generally speaking, for the vast, vast majority of people, they're mild and self-limiting. So the vaccines are very safe. And how long you should wait for that second booster, so a fourth dose, is at least 3 months after your third dose. The recommendation is 6 months. It did start initially saying 6 months after your third dose, but anytime from 3 months onwards, you can get that booster or fourth dose. How much does the second booster increase one's immunity? This is a really good question, actually, very specific. I think it's difficult to say in percentage-wise. Generally speaking, I think the initial efficacy of the vaccines was said to be over 90%, which is amazing for these mRNA vaccines. So I'm talking about Pfizer and Moderna, and we may go on to talk about the different types of vaccines a bit later on. But in terms of the booster, we know that it boosts your immunity, especially after 6 months, the immunity wanes. So getting the booster then tops it up. So the exact figure, I think, is still in transition. Lots of figures I've seen banded about 70, 75%, 80% if you're having a fourth dose. So, but we do know that the risk of hospitalization and death is way over, I think 98, 99, like it's a big reduction in that. So that's what we're not talking about infection, we're talking about the risk of serious illness. That's been the shift in focus, actually, especially with the booster. I would say the September booster, the 3rd dose last year, and this spring booster. What was the next question? Was it about the same boost?
Yes, we can come back to that, actually. There's a number of questions about that. This one is, how effective is the second booster against the Omicron variant? And also, the next one is, which variants of the virus will the spring booster target?
Really good question. So what we wondered is whether or not the vaccine would be tweaked to, account for the fact that there are new variants coming. And we know it's part of the makeup of viruses to change. The seasonal flu vaccine is changed every year. It's a different vaccine we give patients every autumn, winter time, because they adapt it according to which flu is circulating in that season. So we wonder whether that will be the same with the COVID vaccine. So far, it hasn't changed. It's the same COVID vaccine we used right back at the beginning when we started vaccinating in December 2020. So the first vaccine to be approved in the UK was the Pfizer vaccine. Then we had the AstraZeneca, and Moderna as well became widely available. And those are the 3 that are widely available. AstraZeneca we're not using for the booster campaigns, but we're using Pfizer and Moderna. So it's the same vaccine that initially worked against what we call the wild type. Then we had, the Kent or, type A, and then it's progressed to the Delta variant. And then now Omicron is the most common variant circulating. So the JVCI looked at the data, and that initial vaccine had enough protection against Omicron, hence why we're still using the same vaccine. Again, we wait to hear whether or not the vaccine will be tweaked come autumn or also future years. It depends on what this coronavirus does. And the variants are being tracked and monitored very, very closely. And we are very blessed in the UK to have such up-to-date data in terms of the tracking of it, as well as sharing information worldwide.
Right, I'm going to come back to that question of tracking and testing, because Faye's asked a question in the chat about it, but hang on to that just for the moment. The next question is, what side effects can I expect? The same as before? Yes, just about the side effects.
Yeah. So the most common side effects, sore arm, you may feel a little bit sleepy for a few days. Some people have no side effects whatsoever. So it's really variable depending on the individual. But what I've seen in my personal practice is that the booster or the 4th dose causes even less side effects. And in fact, the Moderna vaccine, it was found that giving half a dose gives this good immunity in terms of protection against severe illness, but even less side effects. So I would expect with the booster, if you've been fine before, you're going to be fine with subsequent doses.
That's super. Will the booster protect against long COVID? Ouch.
Yes, long COVID is something that a lot of time and effort's been put into it. Still not well understood, but we know it's going to be an issue. So lots of resources. And there is evidence to suggest that having the vaccine protects, even if you catch COVID after having the vaccine, protects against the longer term effects of long COVID, which we are seeing in many at the moment. I'm looking after quite a few.
So it's really worth having it for that reason as well.
Absolutely.
Right, we're kind of shifting into about the vaccine. I just want to check in the chat. Actually, no, could we get on to choice of vaccine? Because there's a number of questions about which one, do I have a choice? Which one's better? All those kind of questions. Am I going to get the same as before, or am I going to get a different one?
So the common kind of theme, especially early on in the campaign, is which vaccine is the best one? And it's the one that can get into your arm the fastest. Absolutely, especially at the beginning of the campaign. So all the vaccines are procured centrally and distributed centrally to the different vaccine hubs. As we heard, it's been the most amazing campaign, the most amazing collaborative effort. It's not just been GP practices, it's been our pharmacy colleagues. We've had hospital hubs. We've had the massive big sites in Twickenham or Chelsea or Tottenham Stadium. It's been brilliant, but all the vaccines are centrally ordered and procured and then distributed to the different hubs. So it really depends on availability. The main ones, just practically speaking, that were circulating initially, Pfizer was the very first one we gave back in December 2020. Then AstraZeneca became available January 2021. So you could get either one of those. And practically speaking, there wasn't much Moderna in the system at that point. Come spring booster and the JVCI recommendation last summer that the booster should be with the mRNA vaccines because the evidence showed that gave a more robust immune response against coronavirus infection. Then there was a lot more Pfizer or Moderna around and a lot less AstraZeneca circulating. You couldn't really get AstraZeneca. Right now, I think the balance is shifted towards Moderna. There's a lot more Moderna in my area anyway. Moderna was what I took myself 2 weeks ago to give my housebound patients because that was what was available in our hub. So in that sense, you don't get a choice. It's what if you go to your chemist or if you go to your GP vaccine hub is what they have available depending, and also their expiry date. So we have to make sure we plan accordingly to make sure we don't waste vaccine because it's like liquid gold and we really didn't want to waste vaccine. So, but the efficacy of both Pfizer and Moderna are on par. And it really doesn't matter if you had Astra, a lot of people had Astra for the first or second, then had Pfizer for their booster, and maybe have been offered Moderna for their spring booster. So that's completely fine. And the evidence showed that that mix of vaccines gave a really robust, good immune response. If you had Pfizer for all 4 doses, that also gives a really good immune response. So hence why those are, there's no choice as it were, it's what's available. But just to explain to you the practical logistics of how the vaccines were disseminated through the country.
Okay, thank you. Now, we've had 1 or 2 questions before and also in the chat. And this is a question I want to raise about how we know what's happening with the virus now that testing has been stopped.
Yeah, really good question.
Where are we going with this? Whose figures do we believe if people aren't getting tested? Some of us got a stash of lateral flow tests before we had to pay for them. I'm sorry, I'm one of those people. But a lot of people aren't testing. There's still the ONS survey and there's still the Zoe self-reporting app. Yeah. But how are we going to keep the accuracy of that, of knowing what the virus is doing?
And it's a really good question, but we have to realize that we do have to learn to, I hate to reuse this term, but live with this virus. So right at the beginning of the pandemic, remember, we didn't have testing to the massive detriment of people being discharged home from hospital. And it was only people who were really unwell in hospital that were offered tests. Think about the flu. We don't test for flu in the community. We don't test for flu in our individual homes. The reason why testing was so important was testing was an important part, especially with the restrictions. And when we're really at the height of the pandemic, it was an important part of trying to curb the spread. So if you tested and were positive, you should stay at home, even if you felt well, because we know that the asymptomatic spread was a big factor in spreading the infection of coronavirus. So that was at the height of the pandemic. Now, as the government tried to get things back and get things moving, it's about how do we live with this? And actually testing the whole population all the time was judged to not be as helpful at this stage. Obviously, the information has been tracked, and if that changes come winter, as we said before, these viruses are winter animals. They come out more in the winter time. That advice may change, but we have to think about it as the flu. We test people who are unwell in hospital for influenza and other viruses, but we don't test as GPs in the community, and we don't have kits to test flu at home. We've been in a pandemic, so it's been a different situation, but as we try to move to more flu-like situation, if you like, we don't necessarily need to test all the time. ONS data and the app are tracking rates and prevalence. So that's the most accurate up-to-date data of what prevalence are really doing. Because you're very right, the testing, because people are testing much less in the last month, the testing doesn't adequately reflect the rates, but the ONS data is tracking that still very carefully, as we do for flu and other infectious diseases as well in the background.
And I'm going to chip in here and put in a plug for the Zoe app. That's the one where you report every day. You're invited to report if you've got any symptoms. and what tests you've done every day. And it's free to download and it's free to use. You've just got to remember to do it every day. A lot of people have stopped using it. I've noticed the numbers have gone down, but it's really important, if you've been using the Zoe app, to carry on with it, please. And to encourage your friends and your neighbors and your family to do the same, because that is, I think, probably the best way, along with the ONS survey. You can't choose to be in the ONS survey or not. They pick you
randomly,
but
out,
you can choose to be reporting every day on the Zoe app. And Faye, I'm sorry, you've put a number of things in the chat there, and I haven't asked you to speak yet. But ONS data is only collected once a month, and so it lags a little bit. The Zoe data is right up to date as long as you report.
Good reminder for me.
End
to
of
keep
plug.
Good reminder to me to keep updating my Zoe app. I just want to respond to the comment about comparing COVID to flu. I do agree, it's not the same. I mean, the COVID has caused a lot of issues, but we have to think back to the influenza pandemic, 100 years ago, where it killed millions of people around the world. So yes, we can't compare flu and COVID exactly like for like right now, but I find it's helpful to get people to think of a situation where we live with COVID and hopefully protect ourselves against it once a year, as we do with flu. But you're right, they're not the same disease or illness. I agree.
And I noticed there that you said that you still mask up in busy spaces.
I do.
And I must say, I do the same thing. If the train carriage or the tube carriage is half empty or only a quarter full, I don't wear a mask. But if it fills up, I put my mask on because I just carry it with me all the time. And the same when I go into a shop.
Yeah, same.
Yeah. Okay, now, in the last three categories of the question, there are less questions and we've actually answered quite a lot of them already. So let me zip through and then we can have some more open discussion. About the vaccine, which vaccine is most commonly given? I mean, you can repeat, you've sort of answered that already. Am I going to get the same as before? What are the benefits of the booster? Has the second booster vaccine been updated? You've sort of addressed that, yeah. But how long will the immunity from the booster last? That's, of course, a slightly unanswerable question, but if you can address those, that would be very handy.
Of course. So the vaccine has not been changed yet. We wait to see if there are further tweaks going to happen with further boosters and campaigns. But so far, the vaccine has not been changed from the initial vaccine that we started giving people. Which vaccine is most commonly given? That's a really good question. I would say now it would be the Pfizer or Moderna are most commonly given by far, definitely. There's very, very little AstraZeneca in the system. There are other vaccines that have been approved. So the Johnson one and Novavax, officially approved, but are not physically available for distribution. So just really the Pfizer and Moderna are being widely distributed and are widely available at the moment. And a plug for anyone that may not have had even their first or second dose yet. Evergreen offer, and it's available for you at any point you decide you're ready to have that as well. And you can have that with the Pfizer or the Moderna as well. The benefits of the booster, we know that the antibody protection wanes, dips, especially after 6 months. So the benefits of the booster are to boost your immunity, boost those antibodies levels back up, and to protect you from severe disease and complication, and protect you from hospitalization, and obviously from death from coronavirus infection. That's the idea of the vaccine and the boosters. Has the second booster vaccine been updated? I've answered that. And how long will immunity from the booster last? Really important question. Everyone's immunity is slightly different. There's so many variables that affect our immune system and our response. We know, broadly speaking, age can be a factor in immune responses, as can if you're on medication or you have a condition that reduces your immunity. So that's why more boosters and more doses are recommended in that age group. But roughly speaking, 6 months is thought to be a time. After that, the JVCI data suggests that antibody levels reduce down, but the level and the rate it does will vary dependent on the individual.
Thank you. We're nearly there. Getting vaccinated, you've really answered these, but I think it's just worth repeating. Will my GP let me know when my appointment will be? And the next one is, I am housebound. What, if anything, must I do to get the booster? And the answer is, don't wait for your call. If you haven't been called, you need to do something about it right now. Am I right?
Absolutely. So lots of letters. I mean, people must have got, there was so much post coming through the letterbox to remind us all about getting our booster. And even if we've had the booster, we may still have got the letter or got a text message or got a call from our GP. So there was so much work being put in because we knew how important vaccinating people. So you may have got invites from lots of different sources. And then somehow it may be that there's no invite coming in. So if you're over 75, you are eligible and you should be having a 4th dose. So you are eligible. So if you've not heard anything, if you've not had a letter, not had an invite, either go on the website, maybe someone can put it on the chat if you're able to, or get someone to help you put your information on the Book Your Coronavirus Vaccine, NHS.UK site, or contact your GP practice and ask them. Because even if they're not delivering it as an individual practice, they may be able to link you into the hub, their local hub, or to one of the local brilliant pharmacists that have been delivering the vaccine in such super heroic numbers as well. And housebound, if you've not been invited and you've not heard, and you're housebound and you're over 75, or you believe you are in one of those severely immunocompressed categories, please call your GP and just make sure you're on a list. That has been a challenge due to workforce challenges and the NHS backlog, and generally speaking. So just make sure you are on a list and they are getting round to you. Find out what's happening in your locality, because every area will have a different procedure for dealing with housebound. But if you're over 75 and housebound, you are eligible for this spring booster. If you've not heard, please contact your GP and find out what's happening with your area.
And hello, Steph from NHS England. I knew you were there somewhere. You have just put the relevant websites into the chat. Thank you very much. And sorry, Kathleen, you've got your hand up?
I just wanted to say, just as Steph did it, that we will send out after this event all the links to the NHS booster vaccine eligibility toolkit. We'll also send out a one-page fact sheet we've got, which we would love you to spread out to any community groups, faith groups, friends, family as well. But I think Steph slightly beat me to it. Thank you.
Thank you very much. Now, we're very nearly there now. The last category is the future. And you've answered the first two, really. How long will we need to have the boosters? Will it be the same as for the flu? And what will happen from 2023 onwards?
I know, I wish I was just demonstrating a glass ball in terms of trying to look into the future as such. We can only base it on what we've seen so far. So how long after the first one will we need to have these boosters? Will it be the same for flu? We think it may be, but we don't know. Will it be on an annual basis? Will certain groups be offered it every 6 months? We really don't know yet at the moment. We can only speculate and anticipate. We anticipate similar groups as the flu vaccine may be offered it from autumn, but it could be a wider group, it could be a smaller group. So we really wait to hear, like I said, the wonderful thing of having that joint committee on vaccinations and immunization is that they do really look at the evidence really closely, and not just the evidence from the UK and our real-term data in terms of vaccinating and tracking infection and tracking complication and tracking response. They're also looking at other countries. So a lot of the information was based on the fact other countries gave boosters before we did, or even gave the 5 to 11-year-old, the children, vaccines before us. So then they made their recommendation using all that data. So we wait to see what will happen. What will happen 2023 onwards? Like I said, my anticipation is that it'll be an annual potential booster or an annual vaccination, but that's just my thoughts. We really need to wait for the evidence and the advice, and also see what this virus does in terms of the pandemic is not over yet. So we need to wait for that global WHO advice on what's happening with the pandemic and case rates locally as well as nationally and globally.
Thank you. The last question is not really about the pandemic at all, but I'm going to leave it in and ask you, and it's a way of then opening up the discussion. We've talked about the effect that it's had on people, and this is a question about the needs of carers. How do we address the needs of elders carers and future planning for care for their loved ones? I know it's a very general question, and it's unfair of me to ask you to answer it in 2 minutes, but I want to be that as an intro to moving out the discussion more generally. And just to underline that it's about the people, this is about the people who've had the virus, but also about all those people often swapping around roles, caring for those, and particularly for older people who are not very well in the first place. It's been a real challenge.
Absolutely. And so I could just understand the question, is it about elderly people who are carers or the carers of elders?
Yeah, I think it's about the carers of elders, but remembering that the two are the same very often.
Yeah.
And I think there has been, I think it's such an, and I think that's what this pandemic has showed, such an unidentified, unappreciated group, whether it's the professional care workforce who, like I always talk about, I feel like they were the heroes in the trenches at the beginning of the pandemic that went out to people's homes or cared for people in care homes without very little protection, especially at the beginning of the pandemic. And they need to be valued and seen for what they did. And ongoing, we need to value this workforce, which is so important for the well-being and the health of elderly populations that need carers. So them being vaccinated is important. The vaccine is offered to carers, not the spring booster, but everything, the 3 doses. And we know there was a lot of ups and downs at times in terms of the offer, especially to care home staff who were very concerned about the imposition of the vaccine. But on the other side, we know that it protected, the vulnerable people they looked after. So in terms of future care, I really feel that we need to learn from the legacy of the pandemic and the lessons it's taught us. And I think if one thing we can take is the identifications of these essential workforce and these essential people and the unpaid workers. So better identification. All GP surgeries should have registers of carers. And I don't know how many people are registered as a carer in their GP records. So that's really one way to identify, and then there's an annual carers assessment of needs that can be done to make sure that you are looking after you, because you need your cup full to be able to then care for your loved one or the person you're looking after on a professional basis. So I do think it's an area that if there's anything we take from this pandemic, we should put more resources and thought into how we really support this essential group.
Wow, thank you very much. And on that note, I'm going to say we've got some time left. We've got another 20 minutes or so to just throw it open and invite people to speak. If you want to speak, I think it's still best to put something in the chat. Otherwise, can you either put up one of those funny yellow hands or your own hand and make it clear if you want to speak. Putting up the yellow hand means that your picture gets shifted to the top, so we're more likely to see you. But there are a group of regulars, Faye and Ira, for instance, and Katie, who've been putting quite a lot in the chat. If you want to say something, by all means, this is your time in the last few minutes. But thank you so much, Dr. Ilozue, for not only answering those questions so very clearly, but we've all, I think, heard the passion in your voice and the commitment for what you've been doing the last 2 years. So thank you so much. And let's just finish off with anyone else who's got something to say. Oh, Frank, I just want to say how positive this experience has been. Oh, yes, absolutely. Ashok.
Right. Just to say thank you to Dr. Ilozue, because there are many questions which always come up, but we don't know the answers. And I think you have given us a very clear answer to all the questions that I had in mind and most people had in mind. And it was absolutely illuminating the discussions you had and the information that you've given us. I hope when we got the recording of that done, we would be able to look at it and then send it to the other groups see that they will benefit out of it. Thanks very much, Dr. Ilozue, again. Thank you.
Thank you, Ashok. Kathleen?
Yeah, I mean, just to repeat what people have said, that I mean, the clarity from Dr. Ilozue was really good. And just anybody has any ideas how we can spread the message out to groups, if people do belong to groups, and what would make it easier for them to get the message out? Obviously, we have the recording, we have our fact sheet, we have the links to the NHS tool to see if you're eligible. But any ideas around that would be gratefully received.
Thank you. Ira?
Just say thank you very much. What about U3A? I go to a lot of U3A meetings once a week, and it would be very good, I think, to get in touch with these areas because obviously most of them are over 60, over 70, most of them are over 70. My only thing is also, how do we prepare for another pandemic? Should we be preparing? Apparently in 2016 there was some kind of session where they were practicing, but nothing was followed up. Do you think we might have learned a lesson this time, that we will be much more aware and be able to save many, many more lives after this awful experience of nearly 3 years? And also, just a quick question, Dr. Ilozue. You said that we are safe at the over 70s, but you also said that after 6 months it wanes, and if we have to wait until September, that for me it would be 11 months.
Yeah, no, really good.
That makes me rather nervous.
Sure. I mean, I think the JVCI based it knowing that older, it wanes faster in an older population. So that 6 months is everything is an arbitrary cutoff. Like, for instance, why is flu vaccines over 65? And they base it as much on evidence-based, and it's on a population health. On an individual basis, people may feel like, for instance, hospital workers or healthcare workers a lot of them felt very aggrieved they weren't included in the spring booster, because obviously they're at risk and exposed on a daily basis sometimes. But the JVCI have to base it on a whole population basis and what the evidence was showing. So even though 6 months was that rough mark by which they see antibodies dip, it's definitely faster in the older population and those who are severely immunosuppressed. So you should expect to still have decent protection, even though it's over 6 months since your last dose. So please be reassured. Yeah, but take the extra precautions to make yourself feel safer. So I'm hoping the hand washing thing, everyone will embed that in their daily practice.
I think if I sing happy birthday twice anymore, I'm going to go absolutely bananas. Sure. But
proper hand washing, having that hand gel, that alcohol gel in your pocket, I think those practices should maintain. Washing your hands as soon as you come in from the outside, all those, that will protect against all infectious diseases. Think about norovirus, and we didn't see as many respiratory viruses the last 2 winters because people were practicing these good infection control measures that should be universal and ongoing. So, yeah.
Thank you. Yes. Brian Naylor.
Hi. I run a small visually impaired group and also occasionally an older people's group. And I'm glad to hear that we're going to get some notes from this meeting, which I think will be extremely valuable. But I am not an expert. And when I address these groups, I find that they ask me questions which unfortunately I can't answer. I was wondering if there's any possibility of getting either a short video, or particularly for the visually impaired group, a short audio tape, something of that sort, which could explain the need and the way and the method of getting this booster and the future, if you like, so that we can actually have an authoritative version to give to our members.
Is there something like that available at the moment? Does anyone know?
Well, we can share this. We can share this video, Brian. If it would help, people could listen to the audio version of the video and listen to the questions and answers. Do you think that would help?
Well, thank you. If that's the case, I'm delighted to hear it. But the issue there is I am 85 years old, not the brightest, certainly not the sharpest knife in the drawer. I don't know how I would actually access it. So if you can send me some way of accessing this video, that would be useful, particularly as I think this session has lasted for quite a long time. I wonder if an extract of it, the key elements perhaps, might be more useful than the entire video. Does that make sense?
It does make sense, but then it would take longer to edit and change about, as you can imagine. The simplest, quickest way to do it is just to put this video on the AgeUK London YouTube channel and share that so that somebody can watch it and stop and start it whenever they want to. And it's just, YouTube is just the website platform. It wouldn't be a complicated thing about having to log into Zoom or do any of that stuff. It would be a much simpler process to listen to it. Obviously, if people with visual impairment, they can still hear the audio.
Yes, yeah. Okay, well, that's fine. Thank you. That's extremely helpful. I will certainly look for it. Thank you.
Okay.
Does anyone else have a question?
Yes, I'm Marda. I keep putting my hand up, but I keep losing you on screen. And then every time I come back in, my hand is off again. So things are going very funny with this now because the picture just keeps going down to the bottom. But I did lose it entirely for 5 to 10 minutes, about 10 minutes in. So what I was asking is, where can I access a recording to get that bit that I missed? Is that going to be, are you going
again, as I said to Brian, this whole recording will go onto the AgeUK London YouTube site. When I email everybody that registered to attend the meeting, there'll be a little link that you can click and it will bring you to the video and you'll be able to watch the whole thing.
All right, I will try that again. Is it possible? Unfortunately, I lost you in the bit I was really into. And would it be possible for me just to ask a quick question now? My eligibility. I'm 73. I was just extremely clinically vulnerable. And I have, a few months ago, been classed as frail, and I have my care plan. And yet I'm still told I'm not eligible because I'm not immunosuppressed. Yeah. So is that right, or is this just dodgy lines?
Sorry you weren't here when that question came up.
Oh, Dr. Did it? Oh, sorry, that's because I'm saying I dropped out and lost you.
Dr. Ilozue.
No, thank you for that. Yeah, no, unfortunately for the Spring Booster, you're not eligible unless you're immunosuppressed, or I take it you don't live in a care home for older adults either. So, but it's brilliant to hear that you've had a care plan done. I like the sound of that. I hope you found it helpful. And
well,
maybe
no, I was a bit bemused by it all at the time. To be told, I'm frail when I'm actually a reasonably active person, but I have various medical things going on. And then said, can I do the care plan? And it was the only bit when she got to, do I want to be resuscitated? And I said, well, I am only 73.
Yeah. Yeah.
And I feel that I've got a bit of life in me to go. But at least I appreciate I had to ask the question.
Yeah. And I think the idea of those care plans is supposed to be personalized. That's the other buzzword. So it is supposed to have your input and identify your individual goals and aspirations, you know, as well they may be. So yes, there's variability in the way that they sometimes input it, but I'm glad to hear that you've at least had the opportunity to have that discussion with someone.
Thank you.
Thank you. The next questioner is Samantri Desai. You need to unmute yourself, sir.
Good afternoon. I'm 82 and my wife is disabled. She's 74. We both had 4 vaccinations and the 4th boosters. How do we keep a record of this track of these vaccinations? Because I keep forgetting And when do we have to apply for another booster?
Okay, good question. So keeping track, if you have access to the NHS app, I understand not everyone may have a smartphone, but it should be on your NHS app in terms of the number of vaccines you've had. It will be on your GP record. So you can ask for printouts if that's easier. You prefer paper. You'd have the vaccine cards you should have been issued with. So some people clip them together as a way to keep track themselves. And in terms of when you'll be offered the next dose, we're still waiting to hear from the Joint Committee on Vaccination and Immunization, the JVCI, about their recommendations for next booster or seasonal, kind of our seasonal campaign, whether it will be alongside the flu vaccine, which usually we start offering that from September onwards. So I anticipate this summer we'll hear more about the autumn campaign concerning the coronavirus vaccine. We don't know as yet the details of that right now.
Yeah, but will they write to me or?
Yeah, they should invite you in. It may be your individual GP practice, and maybe your local vaccine hub. But look at the news. BBC was a great source of information for all of us. So you may hear from it from the standard national news as well. But if you've not heard, and it's come September, when you go and have your flu jab, if you've not heard by then, that's a good time to ask the question too, if you've not heard by then, because you will be invited for your flu jab, as I hope you are every year.
Yeah. Thank you very much.
Thank you. Harriet is next.
Yeah. Sorry, can you hear me?
Yes.
Yes, please. So my question really is, this month will be the anniversary of a cousin of 42-year-old that died from taking the vaccine 10 days after taking the first dose of the AstraZeneca. Yeah. So I've got younger relatives now, and I cannot encourage. They are saying they are not going to take any vaccine. So what do I do about this? So it's really so no, it's still raw.
So tragic.
Yes.
Yeah. So sorry to hear that. That is awful. I mean, in terms of, I don't know if you wanted to share specific details, but do you know which vaccine it was and what the side effect was?
AstraZeneca, okay, 10 days after the first dose.
Okay, and was it one of those really rare, awful clots that?
Yes, caused, exactly. Yeah. Yes, severe brain hemorrhage and clots. Yes.
Oh, I am so sorry to hear that. My deepest condolences. It's just the worst thing you could. Yeah. It was extremely rare, but when it affects a family, the impact, of course, is massive. All I can say is condolences. It is the most frightening thing to have experienced to someone close to you. It was extremely rare. It was only identified after millions of people have been vaccinated. And I'd say that if those younger relatives wanted to have the vaccine, based on that as an extra precaution, anyone under 40 was not offered the AstraZeneca. So if they're under 40, they wouldn't be offered the AstraZeneca vaccine. But right now, even if someone is over 40 and wanted vaccination, there is no AstraZeneca practically in the system. So they would be offered a Pfizer and Moderna, even if it was their first or second dose. So nothing is without side effects. You have identified one of the very rare, awful side effects in terms of these awful clots that caused that disease, death in young people, very few occasions. We have to remember COVID infection itself caused those awful clots too, in bigger numbers. So as everything, it's a risk benefit. So the risk of complications from COVID infection still remains more than the potential risk of that awful small side effect from vaccination. But of course, it's very hard to tell people who have experienced that firsthand. But what I would say is that they probably wouldn't be offered AstraZeneca, definitely not if they're under 40 or pregnant. And right now, practically speaking, it'll be the Pfizer and Moderna in the system.
And has there been any side effect like the clots from the Pfizer and the Moderna?
Yeah. So the most severe, not the clots, we haven't seen it with Pfizer and Moderna and the mRNA vaccines, but we have seen instances, especially in very young teenagers and young people, of inflammation around the heart. But that's been the main side effect we've seen in terms of severe side effects, but rare and in many cases self-limiting as well. So that's what I would say.
Thank you.
Does anyone else have a question? Mara.
I was wondering whether anything was being put in place for people who don't qualify for the 4th booster, but have hospital operations dates, and whether they were going to give boosters to us just to help us, or prevent us catching it while in hospital. I mean, they've got such a backlog anyway. If you've already waited a year and a half, the last thing you want to do is, have it cancelled because you've caught COVID.
I know, that's a really good question. So based on waiting for hospital procedure, that wouldn't be a reason to have the vaccine in itself if you're not part of the eligibility groups for the spring booster. I know a lot of hospitals are testing. One of my relatives is about to go in for a NEOP, and they're sending out tests to do before you go in, and they'll also test you on admission. And that's about the operation itself. Unfortunately, if you test positive, the procedure may not be able to go on, but it's also about where they put you in the hospital as well, because they're still trying to do some semblance of infection control for admitted patients. So unfortunately, you wouldn't be eligible for the spring booster on the basis of waiting a hospital operation, but you will be offered a test before you go into hospital in most cases, from what I've seen.
Thank you very much.
You're welcome.
Yes, and Mara, my sister is due to have knee surgery, and she's got a pre-op assessment today, and she's going to be tested before, and she's got to self-isolate for several days before going into hospital to reduce the risk of her picking up an infection.
Yeah.
Any more for any more? Alexis White.
Hi, my question is just a bit more of a general question. Now that the COVID tests you have to buy, is there any exemptions that maybe COVID tests could be for people that are on low income, or for vulnerable people that haven't got any means of income? Is there a way they can get a COVID-19 test?
That's a really good question. From what I understand, some groups are still offering free testing. So I saw someone put in the chat that they're still offering their workers, twice weekly lateral flow tests. As a healthcare worker, I'm still able to access lateral flow tests for myself and other workers in the surgery, in my practice. People who've been admitted to hospital need a test. But I think we're moving towards the direction of you don't need to test the population at wide, especially if you're not necessarily in an area where you're exposed to lots of infection, in terms of caring for very vulnerable people in a care home, say, or in a AgeUK social group, for instance. So I hear what you're saying about low income, but I think the understanding was the expectation is that you don't have to test as we had to a few months ago. Those legal requirements for testing has been lifted. So there's no mandatory requirement to test in general settings anymore.
Okay, so if you've got symptoms and you want to test, but you can't afford to, then I guess
if
you're
you've
not
got
gonna...
symptoms and you want to test, I mean, if you can isolate, fine. But I think the thought is, if you feel well enough to go about, maybe take precautions like a mask, but that you don't have to test at this present moment of time.
Okay, thank you very much. Thank you.
Any other questions? Well, we've got just another 5 minutes to go, but we've been at it for nearly an hour and a half. So I'm going to wind up the meeting there, just to say a huge thank you to Dr. Ilozue for answering all those questions so brilliantly. I'm just going to leave it at that. And for all the clarity and the commitment that you've clearly put into this task, this job that you're doing. Ashok Dutta, thank you so much for your contribution. And again to the campaign staff at AgeUK London, who I appreciate your commitment and the hard work that you do, not only on this campaign, but others as well. That's Kathleen and Sharon. And thank you for all those people that I haven't called who've contributed in the chat. Frank, you've been texting away about your centre in Wandsworth, and thank you so much. And to answer you, I'm not quite sure there's going to be another meeting around the COVID vaccine unless and until we know what's going to happen in the autumn, where there might well be something, but probably not until then. And anyway, I think we're all hoping that you can go and have a mostly decent summer.
There was a question about the homeless population, if they're eligible for the spring. Yeah, I think I saw that in the chat. Really good question. And they're not strictly eligible for the spring booster unless they're over 75 or severely immunosuppressed. But that population, the rates of the uptake of first, second, and booster are much reduced compared to other groups. So I would really check that they've had their first, second, and third booster dose. First of all, to see if they could get, and you can get that at any time if they've not had that, is what I would say about that population and other health inclusion groups as well. Thank you.
Thank you for picking up on that question that I missed. And also to say that Steph has posted something in the chat. There's some info about who is eligible for free tests and when here. Now, if you want to, before you leave the meeting, if you want to save the chat, you go into the chat right down at the bottom right, there are 3 dots. And that will allow you to save the chat if you want to hang on to those web links for later.
Yeah,
we can send them out, Tony.
You will be sending them out, of course you will be, along with the one-pager, all the advice and information leaflet, that'll be going out, and a link to the questionnaire as to how was my COVID webinar. Right, we've got 2 minutes. Verena, you're the very last. How can I unmute yourself, please?
Right, can you hear me now?
Yes.
Yes.
Yeah, sorry, it was just a point about the survey that you've put up, that link. A lot of machines that older people have will not connect to that. That requires a more up-to-date machine that actually uses something like Chrome, because some of the older machines use Internet Explorer and it won't.
Sorry, Verena, which link? Because there was quite a few links. That was
the link for the Survey Monkey.
The Survey Monkey.
It will not link to a lot of older people's machines because they're on Internet Explorer still. It only links to the more modern things like
Chrome. To do Google Chrome. I'll do
Chrome.
Yeah, okay.
You're okay with Chrome.
And Faye Sandler, you've been waiting patiently.
But, you know, I mean, if it doesn't go on their computers, you could probably find you can connect it through their smartphones if they have one of those.
Yeah.
Thanks for that, Verena.
Thank you.
Faye.
Yeah, thanks. I just wanted to say, for those who aren't on computers, because we've raised this umpteen times, people like Zara are now holding a lot of face-to-face meetings at the Abbott Centre and things like that. So it may be worth, as part of a focus group, just them to raise their hands and things like that, so you guys can get the information you need without having to rely on just the Survey Monkey for those who are capable, or those, because many people can't actually, as we know, they don't have smartphones, nor do they have the computers to be able to do Survey Monkey. So it's just another forethought that meetings are now beginning to take place again. Or, you know, even a GP practices, maybe to go in like health, utilizing someone like Health Watch or a partnership group to go in and collect from the patients themselves, from the elderly patients that are in the clinic or whatever.
Thank you very
So
much,
just
Faye. Thank you. I'm going to close the meeting now. Could you turn off the recording, please, Sharon? And could